So what is it that you can do in your community to find out what the needs are so that you can win a contract? By speaking with the community, by speaking with the organizations that are in the community, you then, when you talk with the councils, for example, or the NHS, you can discuss that you've spoken with the community, you held a meeting at this location, at a community centre, for example, and you spoke to the people, and this is what they said they want. And I'm able to provide that service, for example. So hashtag replay if you're watching the replay, hashtag live if you're watching the live. So I hope everyone's understanding where I'm coming from and where we are at the moment. We're laying the foundations for winning a contract, okay? And I hope that you've got your pen and paper or computer, for example, and making some notes. We need to then look at where are we going to find clients that we want to work with. So there are a number of ways of doing this. Is, like I said, you go into the community, speak with your community, talk with them to see what the needs are. For example, what are the needs in your community? That's one way. Another way is by speaking with social services and the integrated care boards, speaking with your GP surgery in that location, for example. There's multiple different ways that you can speak to your audience by going into the community, seeing what events is happening, as well as, for example, there could be cafes, there could be charities to do with the age group that you are looking to work with. Go in to that charity and speak with them. Because you never know, they may allow you to hold an event. You can hold an event even in a cafe. There's various cafes around in the UK, that is. And you could say, I'm holding an event. Does anyone want to know how to do that? Because that's a whole new video on itself. And in the next coming weeks, that I'm going to be going live in the Facebook group here, because there's going to be the training that I said about CQC, which is going to be next week. There's other trainings that you've mentioned that you'd like to have some training on. So I do plan to be in here weekly, for example, going live, as well as on YouTube and TikTok, for example. But I want you to think about the organizations that your clients visit or are involved in, working with multidisciplinary teams to talk to them about the needs of the service right now. What is the current needs? And you need to find this out. So when we go through applying for contracts, for example, which is tomorrow and Friday, for example, then you've got a good idea of who you want to work with. Is it government? Is it the private sector? Is it the NHS? Because you need to be aware of these organizations and decide which ones you want to work with, not just sort of go in blindly. I want you to think about what it is, and then you've got to also be thinking about your pricing structure. What are you going to pay your staff members? What will you charge per hour after the staff member's been paid, for example? So if you're paying them, say, £12 or $12 an hour, then what is your rate on top? It can be, for example, you could do 65% or 70%, depending on the organization itself. When you're dealing with government organizations, then yes, they are strapped financially, for example, so the margins will be a lot tighter unless you go for specialist needs. Then the margin is higher for specialist needs. So I want you to think about your client, what type of client that you want to serve. And then you've got to look at the staff members' wages that you're going to pay them. Then on top of that, what is your cost to provide that service? Because you've got your mobile phone to think about that you use for your business. You may have an office or may not have an office. You may have a virtual office. That costs. Then you've got your, for example, your ink that you pay when you print something out. Then you've got your hosting. Then you've got your website domain that you have to pay for. You've got your insurance that you have to pay for. You've got uniforms possibly that you're paying for. So what is it that you're going to be offering? And then this all needs to be broken down that gives you an hourly rate. And I'm referring to temporary placements here. Temporary placement is when you place someone temporarily with an organization, which could be, 12-hour shift or 6-hour shift, or even depends if you're doing home care in the community, it could be 45 minutes, 1 hour shift if you're doing domiciliary home care services where you're providing staff and they're going in the community and they're driving from one place to the other. So they'll be at someone for 1 hour, they could be at another place for half an hour, for example. The rate that you charge depends on the location and the work that's involved. So if they are doing low needs, then for example you're paying them say £11.50 an hour, then your rate on top of that is probably going to be about £16-17 an hour, depending on your location of where you are. So you have to do your research for the location of where you're going to provide that service or where that contract actually is as well, so that you can give a good pricing. So that way you can say, right, my price is, because you'll need to break it down, you're going to pay the carer. In order for the carer to step on site, just alone is this price. Okay, so you pay the carer £12, then you would say £12. Then there's the company's fees. Our margin, our charge rates are 60%, for example. So then that could equate to, so if you're paying someone, say £12 an hour, then there's 65. So then your £7.80 is your charge rate per hour. Then you're going to say your total charge is £19.80 per hour to put a staff member into the establishment on a temporary basis. Your hourly rate would be this, £19.80, for example. Okay? If you're sending staff members into care homes, into hospitals, for example, it all depends on the level of service again that you're providing. So if it's medium to high needs, then your price will be different than the low needs price rate that I just mentioned to you. So if you're doing medium, then you would look at your rate is the staff member is being paid, for example, 15, 16, 22 pound an hour, for example, then your rate is 65 pounds. Sorry, 65% is your rate on top of that. So if the staff member is being paid £25 an hour times 65, your rate is then £16.25 per hour plus your staff member to step on the premises. So then your rate is then £41.25. Now, if you are providing a higher level of service, then your rate could be that you're paying the staff member £40 an hour. Okay, so then 65% of that is £26 that you're charging as a company. Your charge rate is £26 an hour, and that person is being paid the 40 an hour, for example. So then you're then charging, say, £65 an hour. So you see where I'm coming from. The higher up you go, the better the margin is for your company. The profitability is better. And then you then are able to reach your 7-figure a lot quicker. Okay? So if you was, for example, providing permanent staff members like I mentioned before, just by providing 3 staff a month, for example, nurses that I mentioned earlier, it gave 200,000, didn't it? So to get that to 1 million, for example, that is, you need what, 15 staff members? Yeah, so you got to times that 3. Let me just do this. 3 times 5, that's 15, times, let's do 15 staff, times 37, 555. So 37, let's just do that again. So you need to place 15 staff members a month at 37,000. You're invoicing, for example, you're billing, the amount really is 555, but that's the wages, but you're getting a percentage of that, which is going to be, say if you did 15%, you would then be on 83,000 a month by placing 15 staff members permanently. That's not residual, the same 15 staff members. Every month you've got to find new staff, 15 staff. So you keep placing, you do the same thing the month after. You can mix this with healthcare workers and nurses. It's up to you how you do it. So if you place 15 nurses at 37,000, and then you're charging, you may even do 10%, but I'm just going to say 15%. So again, 83,250 in month 2. And then you do the same, because when you're looking at that, earning that amount of money, and you're doing temporary work, you got to do treble more to earn that. And I'm referring to you here in terms of placing permanent staff members. Permanent staff members. So you haven't got the wage bill to pay. You haven't got the PAYE to pay, for example. All you've got to pay for is your costs, like if you got virtual office or whatever, your mobile phone, all of your expenses. Your profitability is more like 80 to 85% net profit